Hello again, everyone, and welcome back to Reddit Aliens. I'm John, and as always, thank you so much for being here. A good topic, one of my favorites. Let's do it. Doctors of Reddit. What was a time where you said to a patient, "How are you still alive?" Please remember to like, share, and subscribe. I witnessed a 65-year-old man who had broken his femur fall off of a roof he was repairing, land on a fence, and accidentally snap. We rushed him to the hospital because he couldn't move. Once he was stable, I asked for his history. In 1969, he was involved in a motorcycle truck collision, which resulted in a broken back and hips. In 1970, his leg was destroyed by a machine gun in a riot in his home country. He was immobilized for 2 years and became infected. 1980, involved as a passenger in 2 head-on car accidents within 2 months of each other. Everyone else died in each event. He broke his hips and knees again both times. In 1997, he fell off another roof and sustained a fracture to his back. 2003, shooting a shotgun on a farm, it exploded in his hands, and now he can barely move his left hand. The 2010 workplace accident broke his back. 2013 fell off of a small cliff and broke his back. In 2017, his wife advised him to exercise caution, which led to his current accident. We're getting there with his rehab. During my rotation in a rural area, I encountered a man who had been walking in the woods when he suddenly felt faint, sweaty, and experiencing severe abdominal pain. He collapsed, but somehow managed to crawl out toward the main road, where he got the attention of a passing car that brought him to the hospital. He had an abdominal aortic aneurysm that had ruptured with all his blood pumping out into his belly, and somehow survived till he got to a hospital and had emergency surgery. Upon our meeting, he had fully recovered and was on the verge of his home discharge. He showed me his scar, telling me how he didn't know how he made it either, except that he knew he wasn't going to if he didn't keep crawling. They were really made tough out there. I'm not a doctor, but a patient. 2001, I'm 18. Severe abdominal pain starts on a Tuesday morning. Tuesday evening moves on to vomiting. So frequent, in fact, that I begin to vomit bile. Coils of bile. Think of it shitting out of your mouth. I was convulsed all night. A Wednesday around noon, head to ER. The patient was admitted with a fever of 105 degrees. White blood cell count still normal. Treated for fever and dehydration and released. Feel comfortable for 2 hours. The patient was admitted once more, this time with a fever of 107. Whoa. He was left alone and forgotten in the ER for 2 hours, still convulsing. Girlfriend hunts down the doctor and gets a private room for observation at 10 p.m. Midnight, MRI, and the tech says, "Oh shit, the appendix was perforated." The patient was diagnosed with full-blood sepsis. Doc says an emergency operation will be at midnight. 8 a.m. wheeled into pre-op. The surgeon tells my parents I probably won't survive surgery. However, I'm still here. I'm the patient the doctors were shocked by, twice. It wasn't, "How are you still alive?" but, "How can you be this healthy when you're very sick? It doesn't make sense." After experiencing a mysterious illness similar to tonsillitis for the 4th time since January, I received a diagnosis of acute myeloid leukemia in early May. I went from a normal white cell count on April 9th, which is around 4 to 10,000, to 87,000 on May 3rd. And the next day, it was nearly 100,000. And the day after, it was over 100,000. When I told the nurse in the ER that my count was 87,000, she said, "You mean 8,700? No, 87,000. And every single nurse and almost all the doctors I dealt with, while they were still trying to figure things out, said, "I've never seen a white count so high." And everyone remarked on how healthy I was otherwise. My only symptoms were a sore throat, swollen tonsils, one lymph gland near my throat that was swollen enough to stick out, and a cough. Apparently, others in my position are usually severely sick. Now, it's time for the "how are you still alive" part. This came about because I knew I would be sick somehow after chemo, and chemo suppressed blood production. I needed frequent transfusions, but I was taking an additional chemo med that made the problem worse, and I hadn't had a red cell transfusion in 6 or 7 days. I should have called my doctor since I was feeling as awful as I was. They would have promptly scheduled my appointment, determined that I required red blood cells and platelets, and promptly addressed my condition that day. But I had felt nearly as bad the month before, and it didn't seem like an emergency to them, so I thought it was normal. There are a lot of things about cancer and how you feel when you have it that I had never heard of. Puking, diarrhea, hair loss, everyone knows about that. Skin peeling, retinal bleeds, opportunistic shingle infections, etc. No one told me about that. Maybe they didn't tell me about the particular kind of crap I was feeling. I couldn't stand for more than 10 or 15 seconds without wanting to crumple over from a discomfort I can't describe and nausea. When I had to walk, I planned my route to take breaks, and it was a short route. Get out of bed, put on pajamas, sit down and rest for 2 minutes, walk to the bathroom and sit on the toilet for 5 minutes. Whether or not I needed to use it, I just needed some place to sit. Walk to the sink, grab a toothbrush and toothpaste, and sit on the bathtub. Brush my teeth, stand to rinse, sit again for a few minutes. Build up my courage and walk to the couch and lie there for 20 minutes until I could head over the blood rushing in my ears. My arms and legs felt normal, and I was relatively sure that I wasn't going to puke if I sat up. This approach proved to be effective. I had 3 separate people offer me a wheelchair as I was walking or resting to my appointment. I should have accepted their offer. I'm dumb. I get blood drawn at the clinic, and when the results come back, I have my hematologist and oncologist and his RN partner staring at me wide-eyed and asking how I could walk through the building, much less not be in an ambulance on the way to the emergency room. I told them I took breaks while I walked. My doctor is normally very calm, but he was like, "Of course you're taking breaks. You're not getting any oxygen." My hematocrit, the ability of my blood to carry oxygen, was extremely low. That's really an understatement. I can't even remember what the number was, but it was stupidly low. I had to have a few pints of blood that day, with 2 pints of platelets. I came back 2 days later and still needed 2 pints of red cells and 2 pints of platelets. And that wasn't to get me to normal levels. That was to get me to good enough considering you have cancer levels. You know, all these stories are really incredible for many reasons. You'll hear plenty more after this one, but just the description of how someone could be circling the drain that closely and for that long, and then just make a full recovery. I mean, the human body, regardless of what you believe, if nothing at all, is a miracle. Mm-hmm. Pretty wild. That's my fiance. On Halloween, EMs brought in a guy they found in his van who tried to cut his own throat. The guy actually dissected out his own throat, and it looked like an anatomy picture of a trachea and esophagus seen through open skin and muscle from a textbook. As we're getting ready to intubate him, he starts moaning that he wanted to die by sliding his wrist across his throat and pointing to himself. Ended up incubating him through his open neck because he had sliced horizontally through the trachea. I'm not a doctor, however I had a doctor ask me this, so I developed a disease called fibromyalgia and have a fairly severe case of it. Before I was diagnosed, I had to work as a delivery driver to pay bills, which I ended up having to quit because of my health. To make it through my shifts, I'd pop 4 acetaminophen, 4 ibuprofen, and 4 naproxen every day. That alone freaked out my doctor and immediately had my liver checked. My doctor then referred me to a pain management specialist due to my inability to continue working. The doctor decides to put me on a pain patch. The only caution he and the pharmacist gave me was to avoid alcohol. They didn't go into much detail about the patch, only stating that it relieves pain and releases a significant amount of medication every hour. I figured if it worked, it was worth it. However, my tendons and ligaments like to tighten and lock up if I'm too cold, and it was January. I put the first patch on and turned my electric blanket on to keep me warm through the night. I woke up 21 hours later, overdosed on a week's worth of opioids. Turns out it was an opioid pain patch for opioid-experienced patients only. I wasn't. And I wasn't even put on the lowest dosage. To make it worse, I have underdeveloped bladder and kidneys, so they're very sensitive. It took me a couple more hours to figure out how to look up the medications and realize what happened. To put this in perspective, having a fever has hospitalized people, and electric blankets have killed many people on it. I had some more side effects, and the doctors tried to convince me to stay on it. I never went back. When I told my main doctor, she freaked out, asked how I'm still alive, and told me to not live alone anymore. I moved back home and started seeing my old doctor again. His face went very pale when I told him what happened. I mentioned the possibility of the doctor losing their license due to this incident. Fun times. The guy tried to kill himself and his wife. He put the gun to his temple and held his wife's head against his own so that it would go through his head and kill her too. He managed to shoot just in front of his brain, exploding his globes and shredding his optic nerves, leaving him perfectly awake and alive but blind. He continued to weep incessantly, shouting she was going to leave me, and why can't I open my eyes? The bullet then pierced his wife's skull and lodged near her temporal lobe, but she was somehow still totally awake and neurologically intact. The situation was both bizarre and horrific. My brother is a surgeon. When he was on his residency rotation, or whatever they call it, in the Dallas area, he told me about a guy who was brought in with abdominal gunshot from a gang fight. When my brother saw the wound, he realized that the guy had been shot right through the stabbing scar that he, my brother, had treated a couple of years earlier. After the guy was out of the woods, my brother went to see him in his room and said, "Hey, look at you, you're dead. I'm looking at a ghost. You're dead." We had an uncontrolled diabetic who came into our ambulatory care clinic. When we checked his blood sugar, it failed to register on the meter. He drew blood, and it separated into a layer of blood and another layer of triglycerides. I can't remember, but his triglycerides were like 8,500 or something, along those lines. He wasn't confused or otherwise impaired. Once we got him started on proper insulin and medication, his levels came down to close to normal, but it was insane. You could have fried bacon with this man's blood. I'm currently a U.S. medical student studying here. I shadowed in one of the only level 1 trauma centers in my region while I was in college. On one particular day, a man helicoptered in from the reservation, 50 plus miles away. This gentleman had downed about 80 ounces of malt liquor by 11 a.m. and got into an altercation with his neighbor over a woman. The neighbor caved in the back of this man's head with a crowbar. It was gruesome. This guy had lost a considerable amount of blood by the time he rolled into our bay, but he was completely lucid and conversational. His only deficits were evident alcohol intoxication and marked visual loss. I'm confident that he managed to survive the ordeal. The most striking thing about that day, though, was a case that rolled in not even 2 hours later. Someone had bucked a middle-aged woman, a lifelong equestrian, off her quarter horse and struck her head. Superficially, she looked fine, like she was peacefully sleeping. Under her skull, however, she had a massive hematoma and would almost certainly never wake up. Sometimes medicine's crazy. The patient was a young, otherwise healthy woman who suffered from postpartum preeclampsia and postpartum cardiomyopathy. Basically, her heart was severely weakened as a pump, and the blood vessels it was pumping into were clamped down, creating immense resistance for even a healthy heart to pump against. She had the most rapid onset of flash pulmonary edema I've seen in 2 decades of ER practice. Pulmonary edema refers to the accumulation of fluid in the lungs. There was so much fluid accumulating in her lungs, when I tried to intubate her, put a tube into her trachea so she could be mechanically ventilated, I couldn't see her vocal cords because frothy water was pouring like a faucet from her trachea. I got the tube in by shoving it into the flowing fluid from her lungs. She not only survived, she was out of the ICU in 2 days and spent less than a week in the hospital. Mostly, this was because of her overall excellent health. It's hard to kill a healthy young person. However, it's not an impossible task. My dad was an ER doctor, and when I was little, he would tell me stories of his patients when he tucked me in at night. Yeah, not your typical bedtime stories, but I loved it. One of the stories that stuck out because it surprised him even was a very overweight guy who came in for some reason, I don't remember now, sorry, this was a bedtime story from 20 years ago, and got treated for something minor and sent back on his way. A few hours later, the lab, which was supposed to run some routine blood tests and mail him the results, called the ER and asked if the guy was still there. His sample had settled after a little while, and it turned out that over a third of the tube was fat. That happens in high cholesterol patients, but no one had ever seen this much in one sample. They had to call the guy back in for a second round of tests and make sure it wasn't a mistake. The guy's lipid and cholesterol levels were significantly elevated. It turned out he was eating 3 meals a day at Burger King. They had to explain to him why burgers and milkshakes 3 meals a day weren't good for him. Ah, the lovely old South. My dad is a doctor. He encountered a man who suffered a scissor-induced heart stabbing and began experiencing discomfort when standing upright. When the X-ray arrives, it becomes clear that the scissor pierced a sac that stays around the heart, and that sac, called the pericardium, should be filled with blood, impeding his heart from beating because of the lack of space in the sac. That guy didn't die on his way to the hospital just because a blood clot closed a hole opened by the scissors. The issue arises from the fact that when the patient stood up, the blood clot shifted, causing him to bleed slowly. My father, having realized that, picked a scalpel that was lying around and stuck it into this guy's high abdomen, right under the rib cage, cutting him open like a pig with no anesthesia, because the patient wouldn't live to see another day if he wasn't operated on ASAP. The surgery proceeded smoothly, leading to the man's release a few weeks later, only to face bullet wounds a few days later. It turned out that another gang, the same ones who stabbed him, were hunting this guy, a known drug dealer. I am a former emergency room nurse. We get an incoming call one afternoon, male mid-30s, found down, bagged but not intubated. They're using the bag to breathe for him but haven't placed a tube down his throat yet. Blood pressure's in the toilet, code is called, etc. Well, they arrive in about 5 minutes and hit the ambulance bay doors, and it looked like they had a Halloween prop on a gurney. After getting him intubated and starting him on a barrage of fluids and pressors, he actually stabilized. And you wouldn't believe his lab results by the look of him. He was severely emaciated, at around 45 kilograms and totally dry. His hair is matted and crazy, adding like 30 years to his look. The most distressing aspect of his appearance was his skin. It was reported that the individual had been absent for several weeks and had been lying on his left side for an extended period of time. The neighbors called 911 because of the smell coming from his apartment. I know it was his left side because when I went to assist the nurse caring for him as she was cleaning him up, and his skin was so broken down over his bony prominences, you could see his hip bone move inside him as you moved his legs. It was just gone. His body fluids, including urine, helped break it down, causing it to completely disappear. Scabies covered him from head to toe. We anticipated a wide range of results from the labs, including abnormally high white blood cell, modes, and even renal failure, and imbalanced electrolytes. Nope. His labs were better than some of the drug seekers who fake illness. He also had no broken bones. His pupils were reactive, and his CT scan was normal. Granted, I have no idea what happened to him after that night. He probably got some gnarly infections, especially with those exposed bone, but none of us expected him to be that okay after we were coding him initially. This is the challenging aspect of working in an emergency room, especially if you're looking for a satisfying conclusion. Often, one never learns what transpires after their departure, even if it involves hospital admission. Rumors circulated that he was a drug addict who either fell or passed out, unable to rise. Back to that smell. I remember when they hit the bay doors thinking, what in the And before I can finish, we all get blasted by the most horrible, putrid, rotting corpse smell that would make your eyes water. And we're freaking ER staff. Lots of us can eat lunch while you're puking. Even though we put him in an isolated room, it permeated the entire unit. We handed out masks to the other patients and visitors, and also offered toothpaste. Take 2 masks, squeeze toothpaste between them, apply it to the face, and proceed to smell mint instead of Satan's asshole. Yeah, that stayed on my upper lip even after I got home. I'm not a medical doctor, but during my time on the ambulance, a second party called to report a baby who'd fallen and hit his head. We got on scene, and the mom was on the phone. Her boyfriend was nonchalantly holding the kid while smoking a cigarette, sitting on the recliner in his skivvies. We asked what was going on, and he said, the baby hit its head. The kid was around 28 months. We took the kid from the guy and started noticing things. He was limp, his clothes were wet, and he was freezing cold. He felt as if he were a lifeless baby, yet he remained alive. The worst thing was, he wasn't crying at all, so we knew things were bad. He had a minimal laceration on his head, like 1 centimeter, no big deal. We knew we needed to get out of there ASAP, so we started loading the kid up, getting him secured on the cot with a C-collar, etc. Asked why the baby was so cold and wet. The guy got defensive and said he was taking a bath. My partner is getting a report from the dad and stops mid-sentence and whispers in my ear, get the kid in the truck and call for police backup ASAP. Fortunately, the fire department arrives and keeps the dad occupied while they finish the report, allowing us to leave. We get in the truck. I start getting stuff to start a line while my partner is doing an assessment, and I know the kid has obviously been abused because he's freezing and wet, but she says, did you see the kid's wrists? I peek under his shirt, revealing a plethora of bruises and rope marks on his wrist. Cut his clothes off, and he's got them on his legs and wrist too. His penis is also lacerated, like it's being flayed. We wrapped him in dry blankets and took a rectal temperature, which revealed that he was 72 degrees Fahrenheit. That's when he started seizing. We got in a line and gave him meds, but he wouldn't stop. Fortunately, the fire department was driving our rig for us, allowing us to complete all these tasks while we were en route to the hospital. We get him in there, he's still seizing, and we turn over care. One of the MDs later said the kid should be dead after being in the bathtub for hours. Children's Hospital got there with a baby bus and ended up saving him. They told us that was the lowest case of non-drowning hypothermia on record for a PEDS PT to be resuscitated from, and the kid made a full recovery with no neural deficits. Cops arrested his parents as soon as we left. I got to see the kid about a year later, and he looked 100% normal, all smiles and laughs. You would never know from outward appearance the ordeal he lived through. I'm currently in my 4th year of med school working on a trauma rotation. Guy with mental illness kills both his parents and jumps in front of a subway train. Cops bring him in, handcuffed to the bed, still conscious and chatty, with most of his limbs, face, and scalp in a mangled mess. He talked about comic books while we literally cleaned tar off his skull, not his head. I actually mean black tar on his bare bone, where flesh used to be. So yeah, not only how are you still alive, but how the shit are you awake and so casually unaware of the situation? There's more I want to say, but at some point I'd crossed HIPAA and legal lines. There was this patient who had come in with some abdominal pain. His description of the pain was vague, and his vital signs and blood work did not raise any significant concerns. Consequently, he spent some time in the ward and underwent various tests. He underwent a CT scan of his abdomen, which revealed the pressure of an unusual collection. We then proceeded with a diagnostic. As soon as we inserted the port, we saw nothing but pus. I see it was pus. At this point, we switched the operation to a laparotomy, and as soon as we opened the abdomen, pus began to flow out. Apparently, he had a perforated appendix that looked to have been at least a couple of weeks old. Well, the whole abdominal cavity was filled with pus. Every time we believed we had completely emptied the pus, a new pocket would emerge. Bowels were so tightly adhered to each other with adhesions that parts actually spontaneously tore apart with manipulation. The surgeon that I was with was a stoic, plump dude with a face made out of stone. All I can remember is his eyebrows raising a little as the first fountain of pus spurted forth. Indeed, the odor remains etched in my memory. Did I describe the smell? It was probably the foulest thing I've ever encountered. It was as though Satan himself had laid a turd within this man's abdomen. Anyway, this man was discharged well, went to ICU for a night, and was discharged to the general wards the next day. Walked out as he had walked in. As a med student at UCLA, I saw a patient brought in from LAX who had just flown in from Japan and had developed progressive paralysis during the 10-hour flight. By the time the plane had landed, he was awake, but so weak he could barely breathe, and he had to be intubated at the airport before transport. We did this huge workup to figure out how someone who'd been intact enough to board a plane with a carry-on bag had ended up essentially locked in. We performed numerous CT, MRI, spinal taps, and lab tests, all of which were unremarkable. Due to a lack of family and travel, we knew nothing about his medical history. Finally, we somehow got the story. Before boarding his plane to Tokyo, he'd purchased a to-go serving of fugu, aka pufferfish. Apparently, his sashimi chef lacked the necessary skills to safely prepare this, resulting in the contamination of the meat with tetrodotoxin, a potent neurotoxin. We ended up keeping him on life support until the toxin wore off, and he eventually made a full recovery. My stepmother once shared with me a story from her time as an ER nurse in Oregon in the 1970s, during which she was involved in a lumber accident. When she entered the room, the doctor instructed her to stabilize her left leg. She glanced at the patient, then turned her gaze back to the doctor, clearly confused. The doctor then said, "The leg's over there," and gestured to the other side of the room. Apparently, the guy's leg had been completely amputated below his hip, along with a ton of other gruesome injuries. My stepmom talked about picking out a ton of chunks of wood before successfully reattaching the leg. Guy made a full recovery. My mother, a paramedic, responded to a call involving a man who had a piece of rebar embedded in both sides of his head. He was riding his motorcycle when he crashed and slid sideways into the rebar on the guardrail. He was completely coherent and had no brain damage. Everyone in the ER and on call had seen nothing like it. They all got to see the MRI afterward, and it turned out that the piece of rebar was miraculously resting between both brain hemispheres. I'm no doctor, but my roommate had this accident with his motorbike. He was speeding, going at 130 km/h, when he lost control of the bike and flew out of the road into a field of cactus. With the speed he had, The thorns shredded him into pieces. All his internal organs got ripped except his heart, getting 10-inch cuts all over his body. He was a meat bag when we arrived at the hospital. All his body was covered in blood. I witnessed several people passing out as they saw him, including his mother. Some organs were brought in those boxes with ice. They administered him a dose of morphine. I believe they did it so he could die without pain. But did the king bastard die? No. The doctor personally administered several serums during the 48-hour emergency surgery, with multiple shifts of nurses coming and going. They literally sewed the guy together, like those Abominations of Warcraft series. He stayed in the ICU for 2 weeks, and just as we were beginning to lose hope, we saw him on foot with a pillow in his hand, trying to suffocate the guy next to him because he wouldn't stop moaning like a pussycat. He blew several stitches and started bleeding all over the place. He then lost consciousness. After undergoing one more operation and spending 2 more weeks in the ICU, he finally woke up and is now doing well. He lost a big portion of his intestines, one of his kidneys, and half of his liver. He suffered some nerve damage, and he has these horrible scars on his body now. It made it into the news too. He now visits the doctors annually out of gratitude, makes calls and sends them gifts. The irony is that he remains more athletic and resilient than most people. I'm an orthopedic surgeon. During my 3rd year of training, a kind Samaritan stopped to assist a lady whose car broke down on a highway. The lady was standing between her car and the helpful Samaritans when a 3rd vehicle careened into it at highway speeds. She had some abdominal injuries, a smashed up pelvis, and dusted lower extremities. Despite hours of operating and multiple staged procedures, she ended up with an above-knee amputation on one side and what I suspect is a stiff and chronically painful leg on the other. A life-saving tip is to avoid standing near the shoulder of a well-traveled interstate. I work as a clinical pharmacist in a hospital. One woman came in with an infected abscess on her neck and was started on several antibiotics that I needed to verify dosing and kidney function for. When the story of how the abscess came to be was told, it turned out she had gotten her boyfriend to lance it with a box cutter. Ugh. This may not be the most hygienic or prudent approach to healthcare, particularly in Canada, where hospital bills are typically non-existent. She recovered with antibiotics, but if the box cutter had gone too deep, or the infection had been caused by an evolving multi-drug resistant bacteria, it could have caused many complications. Someone shot Guy in the forehead at point-blank range, leaving him buried in the desert nearly a mile from my town. He was a mail carrier who was passing through the town at night when he was robbed and left for dead. The man who brought him in claimed that he had been there for some time before anyone could enter to rescue him. I spent the night pulling pieces of the bullet out of his skull and brain and rebuilding his face. I had given up on him, but the following morning, he awoke demanding answers. He walked out of my clinic less than an hour after that, totally fine. The last I heard of him, he was in Vegas. I'm not a doctor, but my father was. He was a critical care doctor for umpteen years. Naturally, he had to deal with patients who had tree branches, poles, and other large, potentially fatal objects lodged in their bodies from one end to the other. Indeed, he possessed anecdotes that defied belief. But there's one story I would never forget. The background first. A father and his child, whose age I cannot recall, were engaged in target practice in their fenced-in backyard using either a bow and arrow or a crossbow. Anyway, the father, of course, handed the bow to the child and gave it a go. He or she missed the target completely and went over the fence. They thought nothing of it. It was not a busy neighborhood, and they had a fairly decent-sized front yard in the front. Apparently, all they saw and heard were ambulances parked in front of their house, and a few minutes later, people were scattered around. Completely clueless, they went out front and asked people what was going on, and were told that a guy was walking his dog on the sidewalk when he was struck by an arrow, and it had impaled him from one side of his head to the other, right above his ears. Fast forward to my father at the hospital. Naturally, the hospital debriefed my father about the events. He walked in the room for the first time, and this man with a large arrow stuck through his head started to have a full-on conversation with my dad. Now, my father, the most composed, patient, non-emotional man I've ever met, admitted to me that he was somewhat startled by how cognizant this man was. He was sitting up in the patient bed, chatting away with my dad, and at one point, the patient said he felt great. I'm sure there was a high dosage of some type of pain medicine that they gave him, but I'm just in complete and utter awe of the situation. The crazy thing was, he made a full recovery. I believe he'd lost some of his motor functions and other things had slowed, but all in all, he turned out relatively normal, for lack of better terms, but my 8-year-old self at the time could not believe it. Still amazes me to this day. The patient was working at a department store when a clothing rack fell on her. One of the protruding rods, typically used for hangers, pierced through the side of the patient's neck. It went directly between two major vessels in the neck. Somehow it went just behind her trachea, without damaging her esophagus. Then it went just under a major vessel on the other side of her neck. It caused a small, minor injury to the lung on the opposite side it entered. She walked into the hospital herself. Surgeons ended up just pulling the rod out in the OR with no subsequent bleeding or anything. To date, it was the most unbelievable CT scan I've ever seen. The patient was a magician who accidentally, or on purpose, still not sure, drowned himself as part of a magic show. Figured he wasn't really a case until he started seizing for no apparent reason, then had massive internal bleeding. As soon as we brought him in for an MRI, he began to scream, prompting us to halt the procedure. He had swallowed a key, and it ripped through his intestines, causing extensive internal injury. He had apparently forgotten about that metal key. Unsure what the problem was, I had my team biopsy all sorts of cool things, and we gave him 4 pints of blood. The biopsies all came back clean, which was confusing. It turned out that no one had actually tested his blood type, only asking him what it was. He didn't tell us the correct blood type. Convinced of my theory, without hard evidence, and being type AB, I insisted my team give me some blood from the same batch. One of them drugged me to make it seem like the blood was foul, and I was having a reaction. Your heart doesn't spin from bad blood. I knew what was up right away. Turns out, he actually did have lupus in the end. It explained everything.